Okay, so this portion is the actual demonstration of the NREMT medical assessment station. I have Rob here as my proctor. He will be giving me the scenario information. Once you walk into the station, you'll be given a moment to look over your equipment. I do have a little bit of it over here on the table for what I will use for the scenario. You'll be read an instruction set so that you know what's going to be expected of you. This station requires you to complete within 15 minutes. Whenever you hit that 15-minute mark, no matter where you're at in the station, your proctor will tell you that you're done and ask you to leave the station. Most people complete well before that 15-minute mark. So I'll go ahead and have him read me my scenario and then we'll start.
Good afternoon, Miss. You're here for the patient assessment management of the medical patient. Today you are dispatched for a 65-year-old male, altered mental status. Upon arrival at the residence, you gain entry to the home and find the patient still lying in bed, lethargic, with his wife standing by the bedside.
Okay. BSI is my scene safe.
It is.
Okay, I'm going to do my scene size up. Is this my only patient?
This is your only patient.
Okay. I'm going to go ahead and request additional EMS assistance just so that I have that available if I need them, because I don't quite know what's going on at this point. Consideration of C-spine, because he's laying in bed, I would ask the wife and see if he fell at all.
Okay. He did not fall.
He did not fall. Then I'm not going to worry about C-spine at this time. And my general impression of the patient is 65-year-old male laying in bed. Does he look at me as I'm walking in at all?
When you ask the wife as to whether he had fallen, okay, because of your voice stimulation, he does look in your direction.
Okay, so not completely alert. Does he keep his eyes open when I'm not talking to him?
He seems very somnolent, very sleepy.
Very sleepy. Okay, so I'm going to go ahead and determine a chief complaint. At this point, I'm going to say that my nature of illness is altered mental status, just because he seems very sleepy, kind of seems very out of it, so we'll start with that.
Okay.
So I'm going to go ahead and talk to him. Is he looking at me at all as I approach him?
As you speak to him, he will turn his head and look at you.
So, sir, my name's Alicia. I'm with the ambulance. What seems to be going on today?
He responds with a very garbled, mumbled speech.
Okay, so he does have slurred speech, so I am going to determine that he is verbal for his level of consciousness.
Okay.
And I'm going to confirm that chief complaint is altered mental status.
Okay.
So I'm going to try and talk to the wife and see if she can give me a little bit more background as to what's been going on today.
Okay, so the wife states this morning she got up before him, which is a little out of the ordinary, went out and started making coffee, and when he had not come out to the kitchen, comes back and he's still lying in bed, which is out of the ordinary.
Okay. All right, so my chief complaint is confirmed with altered mental status.
Okay.
So I'm going to go ahead and check for my life threats.
Okay.
So airway being the first of that. Sir, can you go ahead and open your mouth for me?
He does open his mouth.
He does. Do I notice any vomitus, any secretions that I might need to suction out? So the airway is clear. Is he able to maintain it by himself?
Yes.
Okay. And my patient is breathing.
He is.
Is that fast or slow?
You have rapid, deep respirations with equal bilateral chest rise.
Equal chest rise. Because he is altered, and that could be respiratory in nature, I'm going to go ahead and initiate high flow oxygen via non-rebreather mask. I'm going to go ahead and start that out at 10, low on the scale, because I can always turn it up after I evaluate how that's helping him.
Okay.
The next thing I'm going to evaluate is circulation, now that I have airway and breathing done. Do I see any major bleeding that I would need to control?
There is no major hemorrhaging.
Okay, I'm going to go ahead and check for a pulse.
Pulse is present.
Okay, is it rapid or regular or slow?
You have a fast, regular, strong pulse.
Is it abnormally strong or just decent strong?
It is adequate.
Adequate strong, okay. And then skin color, temperature, and texture.
As you are feeling, even with a gloved hand, you note that his skin is cool to the touch. He is pale in color, and there's a bit of a clammy texture to it.
Then I will recognize that as early signs of shock. I'm going to go ahead and keep the patient warm. I'll keep him covered up as much as possible during my exam. I do already have a high flow O2 on him to make sure that he's being treated for that. I've completed my ADCs because I don't know what's going on with this patient, and it could be something that I can't treat. I'm going to deem this patient to critical transport, and we're going to initiate transport at this time. Now that I'm done with my primary survey, I'm going to go into my history taking. I'm going to do an OPQRST exam. So the onset, ma'am, you said that this onset you don't quite know because you just found him this way this morning when he didn't come out?
Correct. Spouse states he was fine last night when we went to bed.
Okay.
This is how he is acting this morning, and it's not normal for him.
Okay. Has anything been making him better this morning?
I don't know. When I couldn't get him out of bed and he wasn't acting right, I called 911.
Okay. He doesn't seem to be getting worse at all that you noticed?
Not that I've noted.
Okay. Has he been complaining of any pain at all?
No.
So no pain that's radiating anywhere?
Not that he has said to me this morning.
Okay. So there wouldn't be any severity because there's no pain rating on this at all.
Okay.
Sir, can you explain how you're feeling right now to me?
He very slowly rotates his head towards you. You can kind of see him struggle to focus his eyes onto you.
Okay.
And any responses that you are getting from him is just very, you can tell he's struggling to get it out to you.
Okay. All right. And time is pretty much unknown. Because he was found this way.
Mm-hmm.
Okay, so we'll go into our sample history then as well.
Okay.
Any other signs and symptoms? Has he vomited at all this morning?
Wife states not that she's seen.
Not that she's seen. Okay, and you said no pain or anything like that. So it's hard to gain other signs and symptoms, but the most obvious vomiting has not occurred. Does your husband have any allergies, ma'am?
He's allergic to peanuts.
He's allergic to peanuts. Any chance that he may have gotten into peanuts at all?
We don't keep any in the house.
Perfect. All right. Any medications that he takes on a daily basis?
He takes insulin.
He does take insulin. So your husband has a history of diabetes?
He does.
Okay. Does he take any over-the-counter medications or vitamins on a daily basis?
You know, we take a vitamin just to try to be healthy, but nothing beyond that.
All right, other than diabetes, is there anything else that your husband has medically?
Just high cholesterol.
High cholesterol, no anything else with his heart?
No.
Nothing, no previous stroke, no nothing like that?
No.
Okay. When was the last time he ate?
Last night.
Last night? And what did he eat? Was it a good meal?
You know, we were over at the neighbors and we had soup, if I remember right.
Okay, so not a really big meal, but
No.
a little something. Okay, and then events leading up to, there was no significant event, you just found him. Sorry, I know I'm repeating myself quite a bit, but I just want to make sure I have the story straight.
I just want him taken care of.
Absolutely. All right, so I've gone through my history, gotten all the information that I have there. I'm going to go into my secondary exam with differentials that I'm thinking of right now. I'm thinking that this could possibly be stroke. This could be related to his diabetes. This could be respiratory, but I'm putting on the oxygen. Has that seemed to help his mental status at all?
He seems a little clearer of thought with the oxygen, but...
Still has the slurred speech,
correct.
Still pretty sleepy. Okay, so I'm going to say that this is probably not respiratory in nature, but I am going to go ahead and listen to lung sounds just to rule that out even further. And what am I hearing?
You hear clear movement of air.
So I'm going to go ahead and rule out respiratory as one of the potential causes. I'm going to do a stroke scale. So,
Okay.
Sir, I'm going to ask you to do some movements for me. Can you go ahead and stick out your tongue?
He slowly works his tongue out.
Okay, and is it midline, pointing straight out, not deviating to
correct.
one side?
It is midline.
Okay. Can you hold your arms up for me?
He brings them up slowly.
Okay,
Equal.
and they're equal. Okay. Can you go ahead and squeeze for me?
Brisk grasp.
Brisk grasp. Okay. I'm going to determine, based on the fact that he has good symmetry, both facially and peripherally, that he is more than likely not having a stroke, and that's not the reason for his symptoms.
Okay.
So neurologically, he seems to be doing okay. So the last thing I'm going to rule out as moving into my vitals is I'm going to go ahead and check a blood sugar.
Okay.
While I'm getting another set of vitals as well. So I'm going to go ahead and prick his finger, and while that's tabulating,
Okay.
I'm going to go ahead and take a set of vitals. I'm going to take a blood pressure.
Okay, your glucometer beeps.
Okay.
You look over and you note a reading of 58.
A reading of 58. So that is low. I'm going to go ahead and prepare some glucose to give to him.
Okay.
I do believe that he is awake enough to swallow at this point.
Okay.
So I will go ahead and start prepping that. I'm going to grab a blood sugar or blood pressure in the meantime.
Okay. Your blood pressure comes back at 136/86.
Okay, it is a little bit high, but I would expect that because of the stress of the situation.
Okay.
So pulse rate,
Pulse rate is 96.
respiratory rate,
18.
SpO2 with the 10 liters of oxygen,
You're at 95%.
95%, and I'm okay with that because he's above 94%. So I'm going to go ahead and administer the glucose to him.
Okay. He accepts it and swallows appropriately.
Okay. I'm going to go ahead and wait for that to get in, and then we'll take another blood sugar here
Okay.
in a few minutes. At this time, I'm going to say my field impression is the patient is in hypoglycemia,
Okay.
and we are treating appropriately for that. My interventions, I do have the patient on high flow oxygen because of the altered mental status.
Mhm.
He's at 95 with that. I'm going to leave the oxygen on for now, just to make sure that he's getting enough oxygen. He was pale, cool, and clammy. I did put a blanket on to treat for potential shock. As we moved into the ambulance, I did keep that on. Blood sugar of 58, which is a little bit low, so I did administer oral glucose, 1 tube, and we will reassess every 5 minutes because I'm still deeming him critical because he's still altered at this point. I'm reassessing vitals. I will wait, I'm going to go with 10 minutes to do another glucose just to make sure I give that a chance to work.
Okay.
So with the second set of vitals, I'll go ahead and reassess the glucose.
Okay. So your secondary glucose after 10 minutes comes back at 74.
Okay, and how is my patient doing with that? Is he more awake and alert?
He is becoming much more clear with his speech with you,
Okay.
quicker with answering questions, and much more alert.
Okay, so at this time I'm going to go ahead and cancel ALS
Okay.
and continue transporting this patient as a BLS patient
Okay.
because I feel like he's turning around. Vitals are stable at this point other than the glucose. What is my second set of vitals?
Second set of vitals comes back at 124/82.
Okay.
Your pulse is now at 84. Your respers are at 16, and your SAT has also continued to climb to 98%.
Okay, I'm going to go ahead and try to reduce him down to a nasal cannula at 4 and see how he tolerates that. I do believe the patient is stable, so I will transport myself. I'm going to go ahead and call in a report to the hospital. Sanford, this is Care 1.
Go ahead, Caroline.
I am transporting a 65-year-old male who was found in an altered mental status by his wife this morning. Patient was last seen last night normally. Initial set of vitals, patient had a blood pressure of 130s, systolic, pulse rate was 96, respiratory rate was 18 and deep. Patient was only alert to verbal stimuli. We did put the patient on 10 liters of oxygen via non-rebreather and did cover him up with a blanket because he did exhibit pale, cool, clammy skin. We did take a blood sugar. Initial blood sugar was 58, so we did administer 1 tube of oral glucose. Since then, the patient has had a repeat blood sugar of 74, is now alert at level of consciousness. Repeat set of vitals is 120 systolic, pulse rate is in the 80s. We did drop him down to a nasal cannula, at 4 liters because he was statting 98 on that 10 liters. If you have no questions or concerns, we will be there in about 5 minutes.
No questions or concerns, see you in 5.
Okay? And I believe that I am done.
Is there anything else that you'd like to do in this station?
I don't believe so.
Okay. You may now